Hi everyone. Thank you so much, Eileen and Miles for Migraine. My name is Neha Sampat. I am a public speaker, actually by trade, and I usually never write a script, and I am never, ever, ever nervous speaking. But today I had to write a script, and I'm super nervous because this is so personal and vulnerable for me. So I want to ask, do I have you with me for the next 8 minutes to support me and cheer me along? Thank you. Thank you. So like many of you, I'm deep into a difficult journey of migraine disease. My episodic migraine became chronic 10 years ago. And I want to talk about this journey, a journey I think is best characterized as a hero's journey. In stories, the hero's journey is a circular one in which our protagonist is first called to venture out, hesitates, but ultimately accepts their calling. They then face many challenges along the way and thankfully gain some insights along the way, and they finally return home, having experienced transformation. So think like Frodo in Lord of the Rings, okay? So our protagonist in our story is called to embark on this journey in spite of their own misgivings. Migraine disease, after all, is significantly debilitating and frustratingly unpredictable. When severe, this disease is ranked in the highest category of disability, along with final stage cancer and quadriplegia. Migraine disease often comes with mental health challenges that make this journey far more lonely and fraught, and thus that much more risky. And yet, we protagonists, we heroes, embark. Well, because we didn't really have a choice, so here we go on our journey. Like Frodo, on our journey, we experience lots of challenges, trials, and tribulations. So let me share some of my own. Tribulation, the actual migraine attacks. I have migraine attacks every single day. Since December 2019, I have had one migraine-free day. One. My symptoms include extreme head pain, neck and shoulder pain and tightness, visual disturbances and aura, photosensitivity, smell and sound sensitivity, fatigue, brain fog, dizziness, ear popping, extreme motion sensitivity, and nausea. Sometimes my migraine attacks get so severe that I cannot speak or even call out for help. I cannot move or even reach over to my bedside table to get my medication. Sometimes one attack will go on for days and days. Challenge, marginalization. Migraine disease has been found to be disproportionately impactful on marginalized populations, including women and people of color. Marginalized populations are less likely to have access to care. They're underrepresented in migraine research. So I hope some of this money that we're raising is going to go towards expanding and deepening the research for marginalized populations. And as I can attest, marginalized populations are more likely to be dismissed, misdiagnosed, and left to languish. Trial, being disbelieved, dismissed, and gaslit. I see some nodding heads. It took years for my symptoms to be taken seriously enough for me to finally receive a correct diagnosis. I've had trusted medical care providers disbelieve me and dismiss my symptoms and side effects when both have been a risk to my life. Just last year, I was in crisis and asked for an urgent appointment with my doctor, only to be told I'd have to wait 7 months to get an appointment with them. This system is broken, and it shouldn't be on the patient who is suffering, struggling, and incapacitated to try to fix it or even have to navigate it. I've also been disbelieved, dismissed, and gaslit by my community and the world around me. There's such stigma and misunderstanding of migraine disease that many people who don't have it, and sometimes even those closest to us, simply cannot fathom or do not want to fathom how bad it really is, which results in us having to explain over and over again, which of course then compounds our misery and our exhaustion. Sometimes, even in spite of those efforts, we find ourselves feeling abandoned. For this is a lonely, lonely disease, the burden of which is disproportionately carried by the patient. And the solitude itself can become the terminal trial our hero faces. Which brings us to the insights part of the hero's journey. My big insight. Heroes' journeys are not solo journeys. Frodo, after all, had Samwise. Buffy the Vampire Slayer had the Scoobies. Dora the Explorer had Boots. Right? So we can't do this alone. We need you with us. Think of this journey out, trepidatious, and back transformed as the loop route we are about to take on our 2-mile walk or our 5K run. How are you all going to help us through? Yeah, it's nice to pop out of your car along our loop course, holding up a sign that says, "I'm here for you, hero." But that doesn't do us much good as we pass you by and your here becomes our there, vanishing into our rearview mirror. Instead, what would it be like for you to be here with us instead of for us? To walk this journey by our side, not showing up when, where, and how it is convenient for you, but showing up when, where, and how it is needed by us. What does it mean to walk with us? Medical care providers and healthcare professionals here, raise your hands if you can or yell out. Thank you so much for being here. How can you be the Willow to our Buffy or the Samwise to our Frodo? 1, connect with us on a human-to-human level. See our suffering. 2, educate yourself constantly on racial, gender, and other biases in the medical system, even if you yourself are marginalized and even if you think you have it covered. 3, always be learning, including on developments in psychology, such as the intersection of trauma and chronic pain, and including non-Western wisdom. 4, integrate and communicate with our other providers. This disease is systemic. We cannot be treated in pieces and still have a chance of being whole. 5, listen to us, believe us, take us seriously. Friends, family, supporters, raise your hands, call out if you can. Woo! Thank you all so much. Here's how you can be the Boots to our Dora, the Gloria to our Barbie. 1, literally just being here and showing up up at this walk is so important. As Eileen was mentioning, like this is a more recent development. Thank you so much to Eileen for starting this walk. This is not the disease that has all the glory when it comes to fundraising, so it's all the more important that we have you here with us. I honestly was really worried I would come here and I wouldn't have people with me, but I have this amazing team, Team Audacious, here. There are people here who are here on their own. People who have migraine who are here on their own. And I want to tell each of you, you're not alone. Come join Team Audacious for the walk. You are not alone. We have you. 2, educate yourselves, supporters, about our disease and let us know you've done the research. This is a huge relief for us and lets us know that we are seen and that we matter. 3, do the daily and little things. Drop off meals for us and our families. Bring a meal back for us when we have to miss out on that dinner we wanted to go with you to. Accompany us to our appointments. Dim the lights and press our heads like my 2 children just did for me last night when I had a bad migraine. Be a shoulder to cry on. Regularly check in with us, including about our mental health. And don't forget to check in with and support our partners and primary caregivers who truly struggle along with us and feel the pain just in other ways. 4, accommodate us. How we used to be able to exercise our friendship with you before we had migraine may not be the best way we can hang out now. So ask your hero, ask your protagonist. I literally mean ask them today while you're on the walk or before you head out for the run or when you come back, what their needs are with their disease. How can they best hang out with you? And maybe be willing to give up your old Saturday nights out to bring new Saturday nights to them. 5, be our ally in action and in words. Correct people who make incorrect assumptions about migraine. Share our fundraising pages on your social media accounts. I think we still have some time to fundraise afterwards. So share our fundraising pages and explain why raising money for this disease is important to you and not just to us. And here's my last insight I want to share with you today. Those of us who are the heroes on this journey, unfortunately, we don't always get to feel like heroes. In this ableist society, we are too often labeled as our limitations. So it is not unusual for us to question our value and feel like burdens to our loved ones. So today, and I hope every day, let's honor the heroes among us by letting them know their value and what we appreciate about them. And again, I mean this literally while we're together today. Do it. Let's see and celebrate their tenacity, their resilience, their perseverance. Let's see and celebrate the compassion they bring to others' struggles and suffering. Let's see and celebrate the magical things that make them who they are and who they still are, despite of their disease. Let's see and celebrate, most importantly, their bravery. For people with migraine, it takes ample audacity to just show up in each moment each day. It takes colossal courage to keep putting one foot in front of the other in the face of dire disappointment, hoping that someday this hero's journey will end and we all, medical providers, supporters, and patients, will come back home transformed. Thank you so much.